Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
In the diaphragmatic injuries, if you see the diagnosis of diaphragmatic injuries, so how are you going to diagnose a patient with diaphragmatic injuries? For the diaphragmatic injuries, there is no single investigation for diagnosis of diaphragmatic injuries. We can do a chest x-ray. First you can put a nasogastric tube and then do a chest x-ray. So when you do a nasogastric tube and do a chest x-ray, what do you see? In the on the chest x-ray, when you put a nasogastric tube, you can see the position of the stomach, because nasogastric tube is put inside the stomach, right? So if there is any diaphragmatic injury, there is a chance that stomach is herniated in the thorax, and if stomach is present in the thorax, the nasogastric tube will be present in the thorax. So as a result, in the chest x-ray, you can see that the stomach which is herniated into the thorax is seen in the um, chest x-ray. Then we can do other tests can also be done, like we can do a CT scan, contrast study of upper and lower GI tract, or CT scan can be done, or even diaphragmatic peritoneal lavage can be done. But all these are not that good, because they might have both positive and negative predictive value is present for them. So it is difficult to diagnose with any of these. Then how are you going to diagnose the diaphragmatic injury? So the most accurate test for diagnosis of diaphragmatic injury is by video thoracoscopy. We have to do a video assisted thoracoscopy, or laparoscopy is done. And if you do a video assisted thoracoscopy and laparoscopy, then you can do two things. You can, number one, visualize the first and foremost, by video assisted thoracoscopy and laparoscopy, you can visualize the injury clearly. And secondly, you can also repair. First you can also evaluate the other abdominal organ injuries can also be evaluated. And because it is a laparoscopic technique or video assisted thoracoscopic, by this even you can repair the injury also can also be repaired. So the most accurate evaluation is video assisted thoracoscopy or laparoscopy.
thank you and thank you for watching.